I used to think a medical doctor and a machine engineer are worlds apart. One works on people, the other works on machines. But these past 2 years, I learned that they can be close partners. In this interconnected world, we just do not see it. But doctors and engineers have collaborated in areas of medical research, diagnostic, even robotics. Not in robotics in Star Wars level, but practically that really saves lives. Today, I'd like to share with you how, as a medical doctor, was able to collaborate with an engineer to create a robot. When the COVID started last year, Filipino nurses and doctors were constantly at the front lines. We were exposed to the new virus and the greater risk of getting sick. We were also unsure how the virus was transmitted, how was it through fomites, meaning objects to surface, droplets, or airborne. So much uncertainty, so much at stake, not to mention we lack PPE, hospital equipments, even simple medical masks. We had a shortage of staff, especially nurses for COVID patients. To give you an idea, the recent statistics showed the lowest nurses to population ratio is 3.8 to 10,000 of a population here in the Philippines. That's how scarce our healthcare workers force is right now. The lowest doctor to patient ratio in the province is much worse, a ratio of 0.8 to 10,000. Yes, all the healthcare system in the world wasn't prepared for COVID, but in the Philippines, it was really severe. So the inevitable happened. Many frontliners got infected with COVID, mortality was escalating among healthcare workers. So I thought into myself that what we can do to lessen this, the exposure time while treating COVID patients, how can we help? So around that time, Facebook and FaceTime became common platforms for remote communication. So imagine how safer would it be and economical if we can check our patients using Zoom. But then how can we do that? Do we provide each bed with a tablet? That would be too costly and inefficient. So I thought maybe we can create a robot that can move around and allow us to remotely do the rounds. Now only will be safe, but we will not pass the virus from patient to patient. So I had an idea, but I couldn't create a robot. After all, I'm not an engineer. Fortunately, I knew Anthony, who was my former classmate in the UST MBA program. Then I remembered that one of his interests was robotics. So I tried to contact him, explain the idea of using telepresence, using a tablet or a cell phone that remotely carried by the robot. As well, it can also carry some medication. Soon enough, Anthony and I were designing the robot. We looked for telepresence robots and these robots that can communicate remotely with your iPad or phone gadget. We look into the markets abroad to see what were the common and logistically feasible in our setting. Anthony and I designed the robot using the principle of telepresence. These are supposed to help healthcare providers avoid prolonged physical contact and with COVID patients while doing interview and lessen the usage of your PPE. But we have one problem. We don't have the materials for prototype making. That's where the UST engineering office came in. Thanks to the college lab, we were able to set up the first LISA robot from scratch. And eventually we got funding from the UST, the OST, and even the Accenture. After months of hard work, the team grew in membership and was able to produce new and improved LISA robot. Before I give the stage to Anthony, let me just share some simple lesson that I learned. First is to recognize the needs. There's always opportunities in crisis, but to achieve this, you must keep your eyes and ears open. Recognize the critical need where you can make a difference. Do not ignore the need, do not live in compromise. Second, the timing, act with urgency. If people's lives depend on it, you cannot delay out of fear or complacency or surrender to it. Third, persistence and imagination. Be relentless in seeking solutions. Think out of the box. Like I had to think out of my doctor's box, imagining being an engineer. Then fourth, and lastly, ask for help. You will be surprised how many people are looking for opportunities to help. Like you, everyone wants to be a better tomorrow. And now, let me turn you over to Anthony.
My interest in inventing things started when I was 9 years old. If you're familiar with compact cassette tapes, it has an analog magnetic tape inside a rectangular casing, wherein you can record and play your favorite music tracks. It is inserted inside a portable media player, popularly known as Walkman. One common problem I observed in using my Walkman is that the battery easily runs out when I try to rewind or fast forward the cassette tapes. To conserve battery from my Walkman, I usually use a ball pen to manually forward or rewind the tape from the cartridge. I thought maybe by having a machine that will work solely for the purpose of rewinding or fast forwarding my cassette tapes, then it will make my job easier and maybe also conserve the batteries inside my Walkman. So I started developing a device from readily available materials I can pick inside our house. I used a small DC motor and attached a small part of a ballpen body in its shaft. The DC motor was powered by two AA batteries. I learned that when you exchange the connection of the wires, the motor shaft will also change its rotation, meaning I can control the forward and reverse direction of the motor. And at that instant, I already have a working portable cartridge rewinder. While looking at my machine, I realized that it is similar with the working of an electric fan. All I must do is to attach a propeller. I made a fan propeller from a plastic gallon container and attached it also to the motor shaft. I was so happy because I was able to add another feature to my invention. It now became a portable cassette rewinder electric fan that I can use to cool me down during the summer season. I showed my dad my invention, and he told me that if I wanted to invent things, I should be an engineer and build robots. Last year, during the first surge of COVID-19, the whole world, including the Philippines, were surprised about the effects of the pandemic. Hard lockdowns were implemented by the national government, wherein businesses, universities, and public transportation were all affected. All the news that you can watch in TV and hear in radio stations were all about the hardships brought about by the pandemic. To tell you honestly, it was also my first time to hear the word pandemic. Personally, maybe like everybody else, I was also worried and afraid. The normal things I usually do were all being restricted. However, I remember the things that I always tell my students during the good times, when the word pandemic was still ignored. I usually tell them that as engineers, we are here to solve problems of the society. And that drove me to take risk and do something within my capability and available resources. With the support from my friend, Dr. Rodrigo Santos, a medical doctor from Medical City Hospital, we developed the LISA robot, or Logistic Indoor Service Assistant Robot. The LISA robot is a remote-controlled telepresence robot with a tablet installed with teleconferencing apps. The tablet is used to communicate with COVID-19 patients and thus preventing accidental cross-contamination between the healthcare worker and patients. We also added features like capability to carry loads such as food packs and medicines, ability to steer into tight spaces of the hospital facility, and ability to deliver alternating current for immediate need to power up some medical appliances. Currently, we already distributed more than 15 units of LISA robots to different private and public hospitals in the country. It is fascinating to realize how a small invention can spark a fire inside our hearts to dream about the possibility of building bigger things. The major lesson I can derive from this experience is to always preserve our childlike curiosity. A child is always curious about how things work and never gets tired learning new things. Like what Pablo Picasso said, and I quote, "Every child is an artist. The problem is staying an artist when you grow up."
Presently, we are working in improving the Lisa robot. We are diversifying its use in other industries like the service industry. We can use these robots in hotels, restaurants, and maybe even the offices. We hope to increase its capacities and capabilities from disinfecting to delivering to monitoring patients and perhaps even have its own artificial intelligence. There are so many possibilities and the future of Lisa Robot looks bright. Some parting advice. Always remember the importance of creativity, innovation, and adaptability, especially during this time of crisis. Never be afraid to share your ideas no matter what field you are in. And of course, it all stems from passion to help others people. As physicians, we are instinctively interested in saving lives, but I believe it is true for all of us humans. People are naturally passionate about helping other people. Inspiration is contagious, heroism is universal. That is all, and thank you, and be inspired.